Hello, good afternoon. Welcome to Traditional Chinese Medicine. My name is Christina Kapothanasis, and today's show is about pain and acupuncture. I am a licensed acupuncturist here in the state of Hawaii, and I'm nationally certified under the National Certification Commission for Acupuncture and Oriental Medicine. I also am Executive Director of the Hawaii Oriental Medicine and Acupuncture Association. Today I'm going to be sharing with you what most people think of when they think of acupuncture, its effect on pain. Pain relief is the most well-known treatment for acupuncture, and I'd like to share with you how we would treat the different joints from head to toe and how diet and herbs may also affect the pain levels. In Western medicine, the whole goal is to reduce inflammation in the body, especially in musculoskeletal pain syndromes. They can do different kinds of tests like MRIs, CAT scans, X-rays, and physical manipulation to see what's going on inside in the body, and they may prescribe different painkillers like more mild over-the-counter pain relievers like Tylenol or aspirin or Advil, and then they may also prescribe stronger pain medications for more severe pain like Vicodin or oxycodone or tramadol, and there are several others that I'm sure you've heard of as well. We all know that we would not like to be on painkillers for the rest of our lives because they're associated with risks as well. If we take too much aspirin, Tylenol, or ibuprofen, we may be having some long-term stomach damage and eventual ulcers or bleeding in the stomach. And for the stronger pain medications that are sometimes in the class of narcotics, they have an addictive quality, which I know that nobody wants to take, but sometimes there's no other options. They also come with side effects of severe constipation and dry mouth, and when you do take them for too long and you are ready to get off of them with the withdrawal side effects, I've seen people go through withdrawal side effects which can be very uncomfortable, with chills and night sweats and fever, nausea and vomiting, feeling like ants are crawling under the skin, and very irritable and like their bones are aching. So we try to offer an alternative to prevent long-term pain medication use and, of course, prevention of the sometimes last resort, which is surgery. People usually don't like going into surgery, and they try everything they can before resorting to that last alternative. We know that you can feel pain from head to toe. I'm sure everybody's felt pain at one point in their life. In Chinese medicine, we say that pain is caused because the flow of energy is not flowing freely in the body. We call that qi. And so wherever there is stagnation and or sometimes deficiency, which will usually lead to stagnation at the end, then we have pain and we need to unblock that. One of the best ways to do that is to use the acupuncture needles. And we have several different sizes. There's nothing to be afraid about with acupuncture needles. They are thin as a hair, and it's nothing more than a mosquito bite. It's nothing in comparison to having a shot for an immunization or getting your blood drawn for some routine lab tests. So the needles come in all different sizes. Some are really short and some are longer to get into fattier tissue, but they never hurt. They do not have to hurt. There's some kind of a electric sensation sometimes, but whenever people are scared, the first thing I do is put a needle in them and they say, "Oh, that's it?" So I hope that you will not be scared of acupuncture either. We have other ways to stimulate the points too, and I will go over those with you in a moment. So let's see if we can start with the different areas of the body where people may feel pain and where we would need to look in order to help these people. We'll start with the head. So a lot of people may be suffering from headaches and or migraines. People can feel these headaches in the front, on the top, on the sides, in the back, and the pain can be shooting from different areas of the head, neck, and shoulders. We are going by the meridians on the body. As you can see on our little man here, he has red lines drawn on his body to represent the different lines of energy. So for example, I have a lady who came in last week with a severe migraine. She starts to feel the pressure and the tightness on the side of her head here, and then it turns into a throbbing pain. When we checked her out, we needed to do points here along her cheek and above her ear, because you can see that this meridian goes around the side. And then we also felt down her meridians on the arm here, and all of those points were sore. So if we can unclog this whole line of energy, then we have the best chance of getting her pain to go away. So when she stood up, she says, oh, the pain and the pressure are gone. How excellent. Also, you can think that any muscle, any set of muscles, here, here, or here, they are going to have a chain reaction of pulling on different sets of muscles. So if we have muscles pulling here that are going to eventually pull here and here, then that will also create the pain. So that's where we would look, for example, on the head. A lot of people come in complaining with neck pain, and that can be from things like working at the computer for 8 to 10 hours a day, or some people are bent over looking into small magnifying glasses, or they may have just woken up that morning with a crooked neck. So we notice that the pain sometimes is along here right by the spine, and then sometimes it's along here on the side of the neck, especially with the crooked neck when you can't seem to turn your head from side to side. For these people, if their neck pain is here, we're definitely going to look here in this local area, but it's interesting that because of the meridians, as you can see, we'll actually need to come down the back here and also out here along the shoulder, because all of these meridians are connected, and it's more beneficial if we can open up all of the meridians. So people with neck pain here, I can find pain all the way out, sometimes to the top of their arm. And we work near the spine and a little bit out to help people's pain. Or we can work on the side here. A lot of people who have not only neck pain, but just the upper back and shoulders are tense from stressful days or thinking a lot, or sometimes their digestive problems will result in these muscles being tight, because these muscles are associated with the digestive system. So these people, we will work along here and down as far as I feel that there is soreness. But one thing that's very interesting is that we need to be balanced on both sides of the body. So sometimes we get partial relief with the points here, but we also need to turn the person over, and we need to look at their front, because one man, I was working on his back, and we weren't able to budge his pain at all. And I thought, okay, let's try the front and see if we can find some sore points there. Every single point I pressed here along under his collarbone and his shoulders down through his elbow. Ow, 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 ow. And as soon as we started working on this and releasing these muscles, which was causing the pulling on the back, then his neck and shoulder pain went away, and he'd had it for years and years and years and years at a very high pain level. So don't be discouraged. If you've had your pain for one day, you woke up with a crook neck, you should come in as soon as possible. And even if you've had pain for 20 years, we still encourage you to come in, because we can still usually help a lot. So then we will also see a majority of people coming in with lower back pain, and lower back pain can be caused also by a number of different types of injury, whether it's sitting at a desk with poor posture, or it's sports injury, lifting the kids above his head. Anything can cause the lower back pain, and sometimes it's actually due to kidney deficiency, which we'll come back to in a moment. Most people feel the pain here, but like we just mentioned how we need to unblock the meridians, we are going to make sure that we work together and find the different points that are sore all along these meridians from head to toe. Even if a person tells me they have lower back pain, sometimes I find that until we start working up here in the neck and shoulders, we can't give them relief down here. Because you can see that there's 4 lines, 2 on each side of the spine, and this is the bladder meridian, Pangguangjing, and then we need to unblock these stagnant points. One man came with lower back pain here, and I had to treat up here around his shoulder blade. Another man came with lower back pain all across the back, and I actually had to treat right here by the spine in between his shoulder blades before we could get the pain to go away. That is a little bit more rare than finding the points in the hips down here. So if we follow the curve of the hips, a lot of people's pain is because the hips are too tight, and the insertions from here to here pull, and then that makes the strain on the lower back and causes the discomfort. So when I press in here and people say, ow, 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 then we know that we've hit the spot. Another thing that will help me is when I insert the needles, I can tell where the problem points are by feeling the smoothness or the roughness of the insertion. I always joke with people that when I feel stagnation, it's like putting together several layers of bubble wrap. And if you put a needle through those and you went one layer at a time, pop, 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 then I know that there's stagnation. And that is something of maybe adhesion or scar tissue that's built up over time, and we just need to get that to soften up and loosen up and relax so that the pain will go away. I can also feel the points with my fingers as I palpate along, and I can see where the biggest knots are, because it's easy to tell on the softness or tightness of the tissues. And sometimes, one man last week, he came in with severe pain from heavy weightlifting, and before and after the treatment, the muscles, you could even see them, they were bulging. And as soon as we got the needles in there to release the muscles, you could even see the bulging going down, and the knots were much smoother. So that's what we're trying for. If we come down to the next joint, we can have knee pain is also another common pain, and anywhere along the knee can need treatment. So if we're working on points here on the back of the calf and the thigh, that can relieve the knee pain. We actually also use these for the lower back pain, because again, you can see that this line runs all the way up here. The Weizhong points, Hensan and Feiyang, are excellent for lower back pain as well. But locally for the knee, they work excellent too. We just have to find, again, where is the sore spot. One lady who sat at a desk all day and had a lot of pressure behind her knees, we relieved her pain by doing here. Other people that are runners and have possibly been strengthening different sets of muscle groups more than the other and they're unbalanced, we may need to work all here along the stomach and spleen meridians to loosen up. Because again, if these muscles are pulling this joint, it's going to pull it out of whack and you're going to experience pain. And then we sometimes do locally points on either side of the knees and below the knees on the sides of the muscle. And then again, I need to go through the whole meridian. So whatever meridians are running through the knee, I might come down here on the gallbladder and spleen meridians on the outside and inside of the calf to see where those pressure points are, where they say, ooh, that's sore, so that I can dissolve those too. What we usually cannot help is when the cartilage is completely gone in between in the knee. So if it's already bone on bone, that's when the relief, the benefits that you can get is usually only a day or two relief, and it's more beneficial probably to go ahead with the surgery and then use acupuncture afterwards for the healing process and getting the range of motion back and clearing out the scar tissue that comes after the surgery. Another pain that we treat all the time is foot pain. Foot pain, there's a term called plantar fasciitis where people feel burning and excruciating pain on the bottoms of their feet so much sometimes that they cannot walk or stand, and they get cramps at night, leg cramps or Charlie horse. So these people, yes, we can put the points directly on the feet. I usually try to go through the tops of the feet because if we go through the bottoms of the feet, there's a lot of nerve endings on the sole, and we can get to the bottom through the top. But the key to plantar fasciitis is working on this set of muscles back here in the calves, because again, the muscle group is tight, and this tendon goes all the way down underneath the foot, and it's going to pull on the bottoms of the feet and make them painful. So we will work to find out which points are sore in their calves and which ones have knots, and or where I feel that rough insertion, and then I know that we're getting it. And we will look at the points on the calf. We can also work on the pain in elbows. So if we're going to work on tennis elbow or somebody who's playing an instrument repeatedly like the violin, then we will need to work on the different points around their arm where you can see their meridians running down through here. Depending on where they're having the pain, we might need to, again, as you can see, the meridians run all the way up through the shoulders, so we might need to come up through here or look on the front of the body and come up through here. So although we'll work with the localized points right here in the elbow, we also want to make sure that we're not missing anything and we're completely releasing all sets of muscles to relieve their elbow pain. And for the fingers, it's similar to what we just talked about with the calves. Whether you're having thumb pain or wrist or finger pain or trigger fingers, all of these muscles, when I make a fist, you can make a fist and you can feel these muscles here working. So I'm going to work a lot up here in the forearm and sometimes up into the upper arm, depending on where people feel more soreness when I press or where I feel bigger knots when we palpate. If we put those two together, we do a much better job of relieving. One lady came in, we didn't even put one needle in her thumb. We put all the needles here to dissolve the knots, and when she stood up, she says, "Oh, my thumb pain's gone, you didn't even put a needle in it." That's very exciting because we're working with Chinese medicine. So we work to use the local points. If your elbow hurts, we put points in elbow. If shoulder hurts, we put points in shoulder. And we also need to look at the meridians. So we're going to follow the meridians lines. Why am I putting a point in your hand when your shoulder hurts? It's because the large intestine meridian runs from your shoulder all the way through your hand, and you feel soreness there as well. And then last but not least, we also choose points to work on the inside problem. And that's what we're going to talk a little bit about next. If a patient comes in with pain, we try to categorize them into what kind of pain they have. We know that person A lifted the heavy beam and person B lifted the heavy beam. They're about the same size, but why did one person get hurt and one person did not? It's probably because one is more predisposed than the other, and we have different syndromes that we can categorize that into. In Chinese medicine, we don't use the word inflammation exactly, but we use the words heat and cold, or yin and yang, to talk about similar concepts. The man who is lifting the heavy beam and he has damp heat in his system, or even yin deficiency kind of heat, may be more predisposed to an injury because that heat is burning off the fluids in the body that help lubricate his joints and keep his muscles supple. The more heat and or inflammation we have in the body, the more brittle the tendons and the ligaments get, and the tougher it is for the muscles to stretch out and be nice and supple. This is a big key to helping people heal. So if we are going to categorize people with heat, excess heat, for example, we might come and do Waiguan. We will be getting two birds with one stone if they have shoulder pain, because Waiguan meridian will go into the shoulder and Waiguan function is to clear heat. We can clear heat out of the feet by doing Tai Cong. So if we do a point in your foot, even though your shoulder hurts or the top of your head hurts, we're trying to flush out the liver heat by taking the heat out of your liver point on your foot. So that's another reason why people say, why does my head hurt? And you're putting point in my foot. It's because of the function. A lot of pain is caused by qi stagnation. So qi stagnation can be a result of different kinds of weaknesses. Being too tired would be the easiest way to say qi deficiency. There's not enough energy to push the blood and fluids around in the body, and then again we get this tightness and not the gentle, supple movement that we usually need. And I see a lot of lower back patients that have the kidney deficiency. So kidney deficiency and or different kinds of digestive disturbance like constipation or bloating and gassiness can also lead to lower back pain. And we need to address what's going on inside, which is why we take the tongue and pulse of every person that comes in, no matter what condition they come in with, because we want to know what's the underlying problem, why did this happen, and what should we do to try to correct it so it doesn't happen again, while in the meantime we work with the acupuncture to heal the local areas. One lady came in with frozen shoulder. She had left side frozen shoulder, and I said, well, we start working on your shoulders. And both sides have, when we see frozen shoulder, they have big knots here. And I said, let's start working with the herbs in the diet for your kidney deficiency, which was so obvious in her pulse. And after a few treatments, when her shoulders were getting better, I said, how is your back doing? And she said, I have no more back pain. I didn't even have to put a needle in it. We just had to replenish her kidney yin because the heat in her body was burning off this cushion of hydration, which we call kidney yin, and that was causing all of her back pain. No needles necessary. So if you're scared of needles and you're too terrified to even try, we may be able to help you with herbs and diet alone. We use a variety of herbs. We have 450 herbs in the book I studied from, but there are over 12,000 herbs in the main Chinese catalog of herbs, and we have about 200 in our pharmacy. So for the person who's suffering from damp heat, we might use an herb like hu zang. This one is going to not only get rid of the heat, but it's going to take out the sticky condition of inflammation that we call dampness. If the person is extremely dry and hot and full of inflammation and their blood is hot, we might use an herb called xuansen, which is nourishing to the yin and it flushes out the heat. It's an excellent cooling herb. No matter what, we're going to use some kind of qi circulating herb, but we need to see if they are hot or cold. So I might use dansen in a patient who is a little bit more on the warm side because this is cool and circulating, whereas if they have kidney yang deficiency, they may be able to handle the circulation of chuanqiong, which is more of a hot circulating herb. This would be contraindicated in somebody who is yin deficient, so you must be very careful when you use the herbs, and that's why we take the tongue and pulse and ask questions to differentiate the syndrome. Kidney yin deficiency, like the poor lady with frozen shoulder and back pain, we might use several kidney building herbs like guiban or nucenzi, which are just little seeds. And these herbs can be boiled into a tea, or we have them in powder where you just stir them in water and drink. We use different treatment methods to stimulate these points. So we're stimulating the points to unblock the qi, and yes, acupuncture uses stainless steel disposable sterile needles to do that most of the time. After we take out the needles, we also may do different kinds of stimulation. These are cups. Cupping is used to further stimulate the points, and we just suck the cups onto the skin, and they don't hurt. They just feel like grabbing a big piece of skin, and sometimes it can leave a little pink to purple bruise for a couple days. That is helping for more blood and nutrients to come to the area, and it will help the area heal even faster. And this feels like a great release when we take them off. So it pulls up, people kid with me, it feels like there's an octopus on them. It feels like grabbing a big pinch of skin, no pain. And then when it take them all off, everybody loves cupping because it just lets their muscles release even further. And the cups come in all kinds of different sizes, so we can use them on different parts of the body, wherever is necessary. I also send people home with moxibustion if I think that they're not too hot to handle this. This is a stick of herbs that burns like incense, so we obviously do not touch it to the skin because it's associated with the risk of burning and or scarring. And when people use this, they get very relaxed, and so that's why we have to be careful. But we can hold it near the painful points or have somebody else hold it for them, for example, in their lower back or on their elbow or wherever they may be feeling pain. And this herb takes its warmth and its energy and it goes deep down into the tissues to promote circulation and healing. And this herb, Aye, is warming and circulating for its properties as well, because this can be made into a tea. And last but not least, we use electric stimulation. We use this while the needles are in, and I use this more for people that I feel the rough sensation when their needles go in that I was talking about. We clip this on the heads of the needles, and it feels like a little eye twitch. If you've ever had an involuntary eye twitch, it's nothing painful. It's a little twitchy, jumpy sensation, and this really helps to knock out the stagnation fast. If I don't feel so much stagnation, but I feel more knots, and it's not as severe, then I will usually opt for cupping. It depends, everybody's pain level and area is a little bit different, so I can't really use cupping on the hands very well. But I try to personalize it to get the fastest relief that I possibly can for everyone who comes in. Thank you for watching, and I hope that you'll give acupuncture a try. Call us if you have any questions, and for today, thank you for joining us. Mahalo.